Thanks for tuning in today. I'm Dr. Nick, the Incrementalist. Join me as I seek out the small incremental changes being applied in other industries that we can learn from and that can be applied in healthcare. Can these changes bring immediate value, but also add up to the big improvements and revolution we need in healthcare? Come along with me to explore the possibilities. My innovative guests from around the globe have used small incremental improvements to achieve their moonshot. And today, I'm delighted to be joined by Dr. Luis Saldana. He is an emergency room physician, a clinician, and somebody that has spent a significant part of his career focused on medical informatics. Luis, thanks for joining me today.
Thanks, Nick. I appreciate you having me.
So today, wanted to sort of focus in a little bit on COVID-19. You have some pretty unique experiences that lend themselves to guide this. Before we get into that, perhaps you could share a little bit of your background, some of the details. You've got an unusual background. Not a lot of people did what you did going back in time. I think there's more folks. Tell us a little bit about that, if you would.
Sure. I think like everybody, your career is kind of an evolution and kind of an ever-evolving process rather than kind of a linear progression. For myself, I consider myself first and foremost an emergency physician. I spent 30 years of my career in emergency medicine, working at busy urban emergency departments. About 10 years into my career, I went through a phase of burnout and actually went back and got my executive MBA. And the timing when I came out of that was good in the fact that our organization, Texas Health Resources, was just considering implementing an electronic health record, and I got actively engaged in that project and started out with a corporate role at that time as a physician executive, as the associate chief medical informatics officer, while I maintained my practice. And then I progressed to be the chief medical informatics officer, where I served for over 10 years at Texas Health Resources, which is a large health system in the Dallas-Fort Worth market. So I've done other things. I've been with some vendors and things over time. I think at this point, I kind of go towards where the puck is taking me, and so that's kind of where my career is, and certainly we cross paths and done some work together and things, and that's where we are today.
So it sounds like as part of that, from a timing perspective, you were right at the nexus of some of the implementation of these early electronic medical records. I'm sure you've got the scars to prove it, right?
Yeah, definitely. Yeah, we actually did that before all the mandates, the meaningful use, all of those things. So the decision was made by our CEO that it was going to be a project to improve the quality of care. And he was quite serious about that. At the same time, the organization had merged two different organizations. And so we actually had to incrementally implement at 15 different hospitals. And so the product itself, the electronic health record, had to evolve over that time. But really the most central part of what we had to deliver for value was physician satisfaction. That's really how it got driven at that time, more so than anything else, which I think gave us a particular advantage in that we started out with that design concern, kind of that type of focus rather than focus on meeting the regulatory requirements. And so that allowed us, I think, to be very successful at Texas Health Resources.
So for me, it sounds a little bit like one of the sort of key assets that you had was a leadership that focused on something that I haven't heard too often relative to, implementation of technology, but physician satisfaction as a sort of driver, I think, must have changed the way in which it was both perceived but also actually delivered.
No, absolutely. I think it really required doubling down on the physician engagement piece, and we actually had to go place by place and really dig in with. We had actually separate steering committees of physicians at each place that gave us input, gave us feedback. This is going to work. This is not going to work. Really forced us to focus on workflows. And so I think what that did for me in my career was really forced me to be very focused on workflow, of being workflow sensitive and delivering say different interventions, different information in the context of the workflow and not separate from it. I think that we really started to avoid a lot of interruptive alerts and really were focused on what are we trying to do. Ask the question, what are you trying to do? What are you trying to achieve? And
right.
So that was a big part of what we did there.
Fantastic. So moving forwards, we had, albeit a small outbreak, but Ebola hit the shores here in the United States. I certainly remember it. And it turns out you were right at the nexus of that for a variety of reasons. Can you share a little bit of the details? Because I think it informs some of what's going on now in our current world.
Yeah, absolutely. It's interesting. So, I, like you said, it was a nexus because I encountered it both as the emergency physician. It actually, first case was actually at my emergency department. I happened not to be working that shift. It was a night shift. And then I also happened to be the CMIO at that time. So basically was over the electronic health record, which, kind of did take a kind of a prominent role, at least at some point in time, during the kind of the how it all played out, certainly with an unfortunate outcome for the patient. Ultimately, the first patient, I think that had a bad outcome, which that was one thing, but then we had other issues and concerns around a couple of nurses that actually became infected with Ebola as well. So, I see what I see today. You see a lot of the similar things. Is being first in the breach is something that forces you to really dig deep and look inside yourself and really survey the issue and say, how can I do the best for the person that's in front of me right now? And, so that it really causes you to focus. But at the same time, the learnings came on communication, the importance of good communication, of engaging all of the stakeholders. At that time, we even have to engage with CDC. So I had, some experience on dealing with governmental organizations at that time, just because it was so prominent at that time, and also actually with dealing with the media. That also created some interesting scenarios as well with dealing with the media. So I think, and also we really had to go back and look at the electronic health record because that came under the microscope at that time. Did this actually add to the case or the misdiagnosis or that type of thing? And so we really took a deep dive, and I spent probably about 6 months looking very focused on all the issues around that. And, one of the key learnings always is it's always about the people. That's one of the learnings I always talk about. It's about execution and it's all about the people. There's other factors, design and things like that. But I think, we both know the importance of clinical communication, that you can have the electronic health record can have all the information you need to make a decision. But in the end, it's clinical people talking to each other that really is going to make the difference for our outcome.
So I think the thing that always stands out to me, and I've been heard to say this a lot, is hindsight is always 20/20. It's easy to look back and find fault, but not to trivialize that. But ultimately, I always ask the question, what did you learn? And it sounds like you learned a tremendous amount as part of that, going through, all of these new experiences, I imagine some of them, plus sort of looking back at the experiences coming in and what changed, which must, at this point, really inform your sort of insights as you think about what is, a pandemic that is affecting us in a completely different way. In that particular instance, it was very narrow, obviously extraordinarily unfortunate for the individual. And, I'm sure you look back and say, what could we have done better? But now you're applying that at this point. As you think about the emergence of this, so, I'm thinking about the data in those first cases. I love this idea of the first in the breach. I think about that. we weren't. I mean, it came from another country. They were, but I think we seem to fail to read the signals. What do you think went on in that sort of initial time frame where I just have the sense we didn't really do the right things? We weren't sort of paying attention.
Yeah, certainly. I think you go back and look in retrospect, but I certainly see it's interesting because there's an emergency physician, Dr. Craig Spencer, that actually got Ebola and worked. He was in New York City and actually worked. It worked COVID, and I think the New York experience was very different than what we saw in the rest of the country, and I saw it even at that time that there was a tremendous amount of medical collaboration. I saw physicians from New York connecting with physicians from Italy, and they were very willing to share. And I think that's one learning is people are very willing to share with each other to improve outcomes. And so I think we did see that. But the challenge is when you get in the breach and you become overwhelmed with cases, and I think that's what we saw is they so rapidly got overwhelmed there, and they were learning on the fly. And I think we've benefited now, when we go back to that, we've benefited now from proning, all the different aspects on ventilation and things like that to really do much, much better. And certainly, that's in thanks to those that what came ahead of us.
Right.
And I think that's always, we have to be humble enough to realize that as physicians that we don't have all the answers, but collectively, I think that's one of the good things about physicians is they do have that collaborative sense of doing better to do better for the patient.
Fantastic. So for those of you just joining, I'm Dr. Nick, the Incrementalist, and today I'm talking to Dr. Luis Saldana. He's an emergency room physician with a special focus in medical informatics. We were just talking about the historical experience that had sort of informed both his own, but I think others. It sounds like one particular physician must have had an extraordinary experience in New York, having gone through that whole Ebola outbreak. But here we are, where I hesitate to say in the middle. I'm pretty sure it's not the middle of this pandemic. I'm not sure where the middle is. Doesn't matter. We're moving forward. And we're challenged with so much sort of changing information. How do you reconcile all of that? How do you help people deal with this shifting landscape that I think confuses many people?
Yeah. Well, I think that is something that is confusing to the lay public. I think as physicians, I think we know about the scientific method, and nothing is ever written in stone because we're always going to keep questioning things. That's how we're trained. That's how we execute, is by keep questioning to get better and keep asking ourselves, questions. And I think, so that's one of the things we've seen with the science here. The science evolves and it's not static, and people want simple, straightforward answers in the lay public. But what, us as physicians realize, and it's a humility. That's a big part of it, is we're humble enough to realize that we don't have the absolute truth. We just try and get pieces of the truth, and the overall truth starts to evolve, and the picture starts to become clearer. And it really is important for us as physicians to dive through all of the complexity and try and simplify the message for those that we talk to. So whether it's lay people, people trying to execute different plans, is try and really cut through the complexity and get to something much more simple.
Yeah, I think the phrase that always stands out to me is that the best available option is always available. Right. The perfect option may not be, and it's okay not to wait for the perfect option. And, guiding that process, I think, is sort of central to how we navigate this. And, let's focus on that, because I think everybody is trying to understand what is our pathway out of this. Is there some emergence of, I hesitate using the word normal, but let's call it, the new normal. How do we get there? What's it going to take for businesses, colleges, How do we do this?
Yeah, well, this is certainly a public health challenge. I mean, first and foremost, we have to recognize it as such, that this is a public health challenge. There is not going to be any magic bullet. The really big challenge with this pandemic has been the importance of asymptomatic and pre-symptomatic individuals. That changes the testing paradigm totally. We're used to, as physicians, testing for a certain disease. Hey, I think it's this. I'm going to send a test for that. But in this case, from a public health perspective, part of our goal has to be to identify asymptomatics and pre-symptomatics, take them out of the general population to keep them from spreading the disease, so that we lower that disease burden. And I think we've started to see that. Certainly the controversy over masking, but we've kept seeing as the persistency of messaging with masking that is starting to kind of take hold even more and more, I think, and that's been an increasingly important factor. But I really think it's difficult for folks that compare it to like the flu and things to not appreciate the importance of the asymptomatic and pre-symptomatic individuals in perpetuating this disease, which does still have significantly negative outcomes for people, and may have, even for healthy people that recover, may have significantly negative impact.
So, I mean, there's guidance out there. We reference you reference the CDC. They talk about this. How do you approach their guidance notes around testing, around tracing, relative to how that applies in the real world?
Yeah, absolutely. I think that one of the things we've seen with the CDC is they have crafted the message that is appropriate for the moment. That's all I'll say on that. They'll craft the message that's appropriate to the moment. So we shouldn't see governmental organizations that are focused on public health changing their guidance based on other pressures, external pressures, and things like that. The challenge was we never did scale up testing to meet the need. So I think a lot of the guidance that came out of them from testing was driven by that constraint. And I think if you let things be driven by the constraint, you're not painting the picture of what should we be doing. And I think we saw that in some of the guidance for schools, for universities on testing, like asymptomatics and screening asymptomatics, which now we're really heavily focused on. And you're seeing these new testing modalities come out that are focused on addressing that concern. Of that. So I think my perspective is follow the literature first and foremost. You have to make the decisions yourself based on what the literature is. That each of us as scientists, physicians and scientists have the obligation to actually go through the literature ourselves. Then you validate that with public sources like the CDC, others that are out there in the public health space. And then you try and craft guidance that is pragmatic. My sense in the ER and even in doing this work is what's the next right thing to do. That's I think if you operate in that fashion, no matter what you do, you'll be fine. But it's really like what do I have to do next? The next right thing. And that if we keep moving forward that way, we won't get anchored in some of the other challenges that we can't address. You have a can-do kind of approach.
So it sounds like this is a full-time job to keep up. I mean, how does a business approach this and get to the point of being able to do the next right thing? Because I think that's great advice, but from a non-scientific standpoint, people that don't have the depth and essentially the training ultimately to really sort of tease out, because there's always a difference of opinion, or at least most times there is, and assessing that. How do you see that for companies, schools, colleges?
Yeah, certainly we're seeing schools and colleges and universities opening up, and I think businesses. We certainly saw safety issues at businesses, and so this really raises the importance of public health. So I think in the next few years, what we're going to see is a real refocus on public health and looking at how do we keep ourselves healthy as a population. And so how do employers keep their employees healthy? How do they keep their customers healthy? We saw the concerns of patients being scared to come to hospitals. That's because they didn't have the trust and confidence that they could be safe coming to those places. So I think this highlights the real need for physicians, public health experts, and others to really drive the conversations with these kind of organizations that don't have the expertise, to give them some guidance on how do you do these things safely. How do you execute these things? Help them to come up with plans that make sense for their company, whatever their budgets are, whatever their constraints are. You can always come up with a plan where you can do the next right thing.
Right, the best available option in that context. So a little bit of time remaining. Obviously, we're in the midst of this. We've seen, various changes occur. Give us a little bit of insight in how you see this developing over the course of the next several months. What are the changes coming around testing, around opening, some of the decisions? Give us a sense of the future in your world.
Yeah, I think first and foremost, we have to be clear that we're going to be living with this virus for the near future. I think that's through 2021. At what point, I don't know. Certainly, we talk about the vaccine coming. I think there will be kind of continue to be improved therapeutics. We've already learned a lot. Certainly you talked about testing. The increased testing of asymptomatics is coming to market. We've seen it in the bubble in the NBA. So athletics, they have high stakes. And I think that's important for all businesses. They're trying to preserve their business model. And so that sometimes shows us a roadmap of how we can get there for bigger bubbles. So the NBA bubble's this big, but we can get to even a much bigger scale of that bubble through good testing, through public health practices, masking, hand washing, hygiene, not gathering in large groups, and contact tracing. So I think the roadmap is there for us, and we're going to continue to see this testing become more prominent in the marketplace.
Fantastic. So, as you think about that future and colleges, working out some of the kinks. I think back to your experience at your hospital. Small number of cases helped you, I think, in that particular instance, to work out some of the kinks in the processes. Same principle here on a larger scale. And then finding those opportunities. If you could just briefly tell us about the testing. I mean, it's a different sort of testing in this instance for opening.
Right, absolutely, yeah. Because you're not focused on diagnosis, a symptomatic patient. As you're looking for screening, you're trying to identify infectious patients. And so it's a different mindset. And so the way you look at sensitivity and specificity is different. And what you're trying to do is capture those infectious patients or infectious people, take them out of the general population to reduce the burden of disease. And that's the long term. That's what we're looking to try and do with making widely available testing, whether it's saliva testing, other methods. I think that'll be rapid point of care testing. I think you'll see cheap, inexpensive testing that makes it available to a broad array of public individuals.
Fantastic. Well, as usual, we've run out of time. Always a pleasure to catch up with you. Just remains for me to thank you for sharing your experiences and giving us a little bit of insight into what I consider to be a positive future. Luis, thanks for joining me.
Yeah, thanks, Nick. I appreciate the conversation.
Thanks for joining me today. Do you have any better ideas, or have you found a small incremental change that's brought about a big improvement in your world? Let's continue the conversation on our hashtag, The Incrementalist, or share with me at DrNick1 on Twitter. You can find more information about the show on our program page at healthcarenowradio.com. And tune in next time to hear my discussions with leaders and innovators from around the globe who've revolutionized their space by using small incremental improvements to achieve their moonshot. I'm Dr. Nick, the Incrementalist, and I'm starting a revolution through evolution.